Welcome to the MSU Lymphedema Clinic. You are likely watching this video because you have been recently evaluated by a physical therapist for swelling of your limb. There are many causes for limb swelling, including treatment for cancer, genetic factors, circulatory issues, heart issues, and side effect of medications, along with injury and joint replacement. Your doctor feels that you would benefit from treatment of your limb swelling. The lymphatic system in this case is designed to pick up large protein molecules, which are the products of cellular metabolism. If that lymphatic system is not working, those protein molecules will stay in your limbs and attract water, and this is what leads to swelling. At the MSU Lymphedema Clinic, we employ a comprehensive treatment program to teach you how to manage your swelling. We typically do not cure lymphedema, but we teach management so that going forward you can keep your swelling under control. Although circumstances may vary, typically we see people with leg swelling 4 times a week for 4 weeks, and for arm swelling 4 times a week for 3 weeks. Treatment includes meticulous skin care in order to create a strong barrier to bacteria that can cause infection. We also teach exercises. These are designed to promote movement of lymph fluid toward your trunk. These should be completed on a daily basis to help the lymph system pick up large protein molecules that are constantly being produced. We then teach manual lymphatic drainage. This is a special type of massage that we will do to you, but also teach you how to do to yourself. This promotes the movement of those protein molecules up towards your trunk. We then follow this with compression bandaging. This involves covering the affected area with a thin cotton sleeve, wrapping that with a thin layer of foam, and then over that several layers of short stretch bandages, which help to provide sequential compression to the limb. The bandages will typically stay on for 22 to 23 hours a day, 7 days a week while you are in treatment. Finally, we fit you or recommend fitting for a permanent compression garment. This garment should then be worn daily in the maintenance phase of your program. Once you have completed treatment and obtained a compression garment, we will educate you on long-term management of your problem. This will include wearing your garment daily, wrapping your legs some or all nights of the week, doing your home exercise, as well as self-massage. There are a few items that you will need for participation in our treatment program. If you have leg swelling, you will need to get a pair of shoes that are 2 or 3 sizes larger than what you typically wear. These shoes will only be needed for the time you are in treatment, as during the maintenance phase, bandages will only be applied at night. We will also ask you to get Eucerin lotion, which is alcohol and fragrance-free, and thus easier on the skin. Finally, bandaging supplies will need to be purchased. Your therapist will provide you with a list of the needed items and some suggestions as to where they can be obtained. While the treatment program may seem a little challenging at first, you will become proficient at applying the bandages and your swelling will be kept under good control. If you don't feel that you can manage this program, either you don't have help at home or you physically can't manage it, then we still suggest that you come in for a few treatment sessions. There we can teach you some self-treatment techniques, including exercise, the self-massage, and skincare.